All right, welcome back to the Growth Over Fear podcast. Today we're diving into a fascinating and often overlooked area of health, orofacial myofunctional therapy. If you've ever struggled with sleep, breathing, TMJ, or even wondered why nasal breathing matters so much, this episode is for you. I'm so excited to dive in. We have a guest, and her name is Emily Gardeski, and she is an expert in the field and works with both kids, adults, to help them improve their breathing, sleep quality, and overall health. So we'll be breaking down what that therapy is, who might benefit from it, common signs and symptoms to look out for, and even simple things that you can start doing at home. But I'm so excited that you're here, Emily. We met in college in Minnesota, Mankato, and just created a connection there. And I was like, oh my God, I need to have her on because this is something not only personally that I like looking back, I'm like, I think I had some of this when I was younger. And so I'm excited to learn more, especially with the clients that I'm seeing and just an area that I haven't had an expert on. So let's dive in. Thank you so much for being here.
Yeah, thank you so much. It's honestly, it's great. I love talking about myofunctional therapy. I love getting it out there. So when this opportunity came up, I was like, heck yeah, let's do this. Um,
Yeah.
so yeah, it's a lot of people are unfamiliar with myofunctional therapy. Maybe they, haven't heard of it. But it's actually been around for quite a while, which surprises a lot of people. There's like research going back to, like the 1870s when his name was like George Catlin. He was first writing about it, going around that sort of thing. And honestly, I'm just glad to bring awareness to it.
Yeah, I love that. And yeah, if you don't mind just sharing a little bit more about how you got into this line of work, what you kind of were doing before, and yeah, what sparked your interest.
Yeah, for sure. So, I went to school for dental hygiene. So I have a background in dental hygiene, but I've always been in the gym area, the gym culture, fitness, that sort of thing. Always been in that realm. And so I did do once I was out of school doing dental hygiene, I went and got my personal training license. And so I enjoyed that too because it was just something I wanted to add to my collection, especially when being interested in whole body awareness, health, that sort of thing. Um, and then I was not super happy with like dental hygiene. I wasn't loving it. It wasn't really what I was hoping for, and I couldn't see myself doing it long term. And so I was open in my mind to other options. And I was learning something and doing continuing education, and I had heard about myofunctional therapy, and I was like, what the heck is this? Because I hadn't heard of it. I remember like a brief snippet, they maybe mentioned it for like a couple of minutes in hygiene school, and then they're like, boop, keep going. You know what I mean? And then I was like, well, wait, what? And then I forgot about it because you get busy with everything else. And so I started looking into it, going into all the free resources that I could, because once I started learning about it, I was like, holy cow, this is such a missing link for so many people. It really connects like whole body health, physical therapy, fitness, wellness, even if you're an elderly person, breathing, sleeping, which everyone needs to do. And
Mhm.
so I got hooked, started learning about it, did my training with Myo Mentor. They're awesome. I felt so prepared coming out of that. And once I learned about it, I just couldn't stop, really.
You're like, I love this. I have to learn more. And yeah.
Yeah, yeah, it was so weird. I was like, okay, I need to order all these books, which I did, and I read them, and it was like enjoyable for me to read. It didn't feel like I was reading because some books, like
Hmm.
educational, they're dense. So I need to
Yes.
mix it up with like a fun book. But these ones, I'm like, these were great. And that's probably just my huge like nerd in me.
Hmm.
But yeah, it was great.
That's awesome. Well, and also, yeah, it just shows how passionate you are about this work, and it really like lit a fire under you to like go into this. So that's super cool. Why don't you just tell us more about like what myofunctional therapy is, and yeah,
Yeah,
like yeah, what is it,
yeah.
and
What is
what are
it?
yeah, like what the heck? What
What the
are
heck
the
is it? That's the common question. Um, so a very simple definition of it is going to be physical therapy for the muscles of your face, tongue, lips, and airway, really. It's about function, is what it comes down to. So, like proper breathing, nasal breathing, swallowing. So, you want to have proper swallowing patterns, chewing, proper chewing, thoroughly chewing your food, creating, those habits around there that last you a lifetime. And so there's really four goals of myofunctional therapy when it comes down to it. It's going to be nasal breathing all day and all night, high tongue posture. So you want the tongue on the roof of your mouth, touching that palate that you feel, that hardness, and the soft part in the back, all day and all night. Proper swallowing technique. And then is lips together. So resting normally and comfortably with your lips together, not apart, just also reinforcing that nasal breathing. And it really comes down to a connection of those four things to airway health, to sleep, to craniofacial development, to really overall body alignment. And people are always a little confused when I say, or when you say body alignment, but the tongue is incredible. It has way more function than just one job of just kind of hanging
Mm-hmm.
out in your mouth, helping you talk, and it is just very multifaceted. And there's actually a thing called the frontline fascia. I don't know if you've ever heard of it or seen it, but it runs all the way from your tongue all the way down to your toe.
Wow.
It's
That's crazy.
amazing. And so that's really where like the whole body alignment kind of comes into everything. So,
Mm-hmm. Yeah, that's something I learned recently. I had like a neuroplasticity coach. Like he was just talking about the neural pathways and he was talking about the tongue and
yeah.
how that literally is like you said, the most functional part of our body, like because it can move in all directions, but also can taste. So like it's really important. Um, do you mind explaining the tongue pot or no? Yeah, the tongue
Yeah.
posture and swallowing, because that's something that maybe not a lot of people understand, or like can you just dive deeper of what like proper swallowing looks like or should be
Yeah.
and the tongue posture? Yeah.
Yeah. So in myofunctional therapy, I just want to preface this. I am not a speech language pathologist. They do way more in depth with swallowing and chewing. So if there is very complex cases and someone really needs it, that's when I refer out, like know my boundaries, you know what I mean?
Mm-hmm.
But when it comes to, especially if someone has a tongue thrust swallowing pattern, so that is when you're swallowing and your tongue, the tip should be behind your two front teeth, and it should almost be like a wave, like a ripple. So
Mm.
that should stay there, and then it should the back should move, where it then moves down so you can swallow. A tongue thrust is almost like a reverse of that. So your tongue is pushing forward, hitting your teeth as you're swallowing, which can then cause other issues as far like orthodontic issues with teeth moving, that sort of thing. People will sometimes choke on water a little bit, that sort of thing. So having that proper tongue posture is also having your tongue up and swallowing and resting up there is really good for your teeth alignment too. So
Mm.
it's kind of like a built-in, orthodontic appliance. I'm not saying don't wear your orthodontic appliance if your
Mm-hmm.
orthodontist, recommended that. But having that built in and doing it properly takes all that pressure off your teeth. Because if you think about it, like if your tongue is constantly pressing on your teeth every time you go to swallow, to talk when you're resting, it's eventually going to move those teeth.
Mm.
The tongue muscle is so strong. So we also see like orthodontic relapse. So someone maybe their teeth are shifting, moving, open bite, and they're like, I've already done ortho, that sort of thing. So, and then we're like, oh, in my head, I'm like, let's take a look at what your tongue posture is.
Mm-hmm.
Is it resting, pushing on your front teeth? Is it sitting behind your front teeth? Is it resting and pushing on your bottom teeth? Because then you can see how that is going to affect your teeth and the way
Yeah.
that they're in your body. Yeah.
Wow, that's so, yeah, it's so interesting. Again, I feel like it's an area that, unless you have an ortho work, maybe you're familiar with some of these things, but like we're not really taught like where our tongue is supposed to be, and
No.
how that impacts, like you said, your whole body. Um, so what are like signs and symptoms of like a good candidate for this type of therapy and like the common cases that you tend to see?
Yeah,
Whether it's for kids, maybe like go for kids and then for adults and then for athletes.
yeah. So we treat where I'm at and what we do at our practice, we treat kids 5 and up,
Okay.
teens, adults. There is, pediatric ones that will see those really little ones, but us personally, we see 5 and up. So this is anyone with chronic mouth breathing, tongue, lip ties, cheek ties, tongue thrust, swallowing, like we just mentioned, orthodontic relapse, sleep disordered breathing, TMJ pain, clenching and grinding. And that's a big one, especially I feel like we see that a lot with females,
Mm-hmm.
TMD
Yes.
symptoms, underdeveloped jaws, children or adults that are needing orthodontic treatment and expansion. That's a really big sign too. So if someone's younger and they have a small airway and they do need expansion, that is a great opportunity to work with a myofunctional therapist. Because what I like to think about this, just to make it a little bit more digestible, is say your arm is attached to your side and it's like it has one way of moving and it's been doing that for forever. And then suddenly it has more room to move. It's not just going to automatically go to those new patterns and new habits because it's been doing and been in this other position for so long. So if you're expanding, you're making more room, which is great and probably is going to allow the tongue to, sit up on that palate.
Mm-hmm.
But it needs to know how to do that first. So it could still be resting low. You know what I mean? So it's
Yeah.
a lot of it is retraining those muscles, and once you have the room, retraining it to sit up there. That's a lot of it. And I always like to think of myofunctional therapy is just retraining proper function.
Mm-hmm.
Um, because at the end of the day, like underdeveloped jaws in children and adults needing expansion, your body sometimes it won't automatically know how to change these functions if it's been doing it for so long, you know?
Yeah.
Yeah. So we
Yeah.
also see chronic neck, shoulder tension, headaches, and people that are preparing for certain like oral and airway procedures, including jaw surgery. So those are pretty much that's a big bubble of who us as malfunctional therapists who we work with.
Okay, awesome. And I love that you said retraining. Yeah, it's literally like retraining your jaw, your mouth to have proper function. So that it makes a lot of sense when you think it's like physical therapy for your mouth and jaw, because you
Yes,
can have,
yes.
like you said, the oral or like the orthodontic work of like the expansion or these other procedures, but then just like with any surgery, right? Like you have to also retrain your body to move, right? Move your shoulder if you just have shoulder surgery or something like that.
Exactly. Yeah. So even, a good way to think about it is someone that, is they have one movement pattern when they're working out. Because I know you do a lot of personal training,
Mm-hmm.
obviously. And so it's like you have one way, they have some compensation pattern that they're already doing.
Yeah.
And they're in pain and they hurt from that compensation. Okay, we're going to fix that compensation, but we have to teach you to get you out of pain how to do that. And
Mm-hmm.
so that's a really good way of thinking about myofunctional therapy, especially when it comes to, TMJ things. So they're using other muscles when they shouldn't be,
Yeah.
which is causing it to hurt in an area. Okay, so let's retrain your body and your patterns. Let's get your muscles moving properly so we can get you out of that pain.
Mm-hmm.
And even too is so sometimes people get freaked out about tongue ties. You
Yes.
know what I mean? It's like,
Yeah.
I don't know, you know what I mean? People get freaked out by it. There's different, well, like with everything, it's a scale. People sometimes think of a tongue tie as being completely tied to the floor of their mouth, but it's really a scale. And it comes down to like when I'm looking at someone and a patient and what's best for them, I don't just go off of visual. I don't just go off of measurements. I
Mm-hmm.
use 5 different things when I'm looking at that. I'm like, okay, what does it look like? What are the measurements of it? What are their symptoms? How is it functioning? And what are their compensations?
Mm.
So I like to take all of those into account before I make a suggestion. Because to me, you shouldn't just be blanketly saying yes or no just off of, oh, that looks like it, or you know what I
Yes.
mean? It's
Yeah.
very individualized because so what we on our scale, maybe we'll call someone a grade 2. Grade 2 is probably it's the most common, and it's also the one that has the most individuality because some people with a 2 may need a release, some people with a 2 may not,
Mm.
because it comes down to their function, their compensation, their symptoms. You know what I mean? And so
Yeah.
I feel like sometimes tongue ties and bringing it up, it's very kind of like a hot subject, hot topic.
Yeah. I feel like didn't I just learned this through my like postpartum client. Her
Mhm.
baby or had a tongue tie and she was sharing that with me and how it got released and all the, work that she did with that.
Mhm.
And she was saying how right there I think your industry got hit hard because people were saying like it was all about money, right? They were saying everything was tongue tie and like and all of that, which I thought was really interesting. Um,
Yeah. And that's what
but
me personally, I don't like saying, "Oh, just because it looks like it, let's do it."
mhm.
I'm like, it is still a procedure. And in order to do a procedure, I mean, there needs to be a reason.
Yes, yes,
You know what I
yes.
mean? You know what I mean?
Yeah,
So yeah,
totally.
it's a scale.
Hmm.
And if you can get your function where it needs to be, you feel great, you have no symptoms, everything, you're not compensating, and everything's functioning normal. I'm like,
Yeah.
if you
Why?
achieved our 4 goals, you feel great. I'm like, let's do
Yeah,
that. You know what I mean?
totally.
Yeah, yeah.
What and so like for someone like so I assume yeah, you see some adults as well that have yeah, TMJ or teeth grinding,
Hmm.
sleep disordered, conditions. What like how much can you change? Like from the development or the function? Like is
Oh,
it
yeah.
possible, you know what I mean? Like of these like of the goals, right? So of like lips together, tongue posture, all of that, like is how long does it typically take? And is it, yeah, like possible or some things there's gonna stay that way? You know what I mean?
Yeah, for sure. And that's another thing is sometimes people think it's maybe just for younger kids,
Mm-hmm.
you know what I mean? And it's really for all ages because at the end of the day, myofunctional therapy is strengthening your muscles of your tongue and your face and retraining those habits, restoring them to proper function. So if there's any sort of dysfunction happening with those, myofunctional therapy can help. So as far as like it's really good for someone that has low tongue posture. So maybe the back is low, but the tip is up. And that's what some people, that one's a little bit of a trickier one because they're like, oh, my tongue is up, but maybe it's just the tip, but the back's not all the way up. And so when things aren't, kind of being held in place, or if that tongue isn't supporting it, and if it's not strong enough to keep itself up, when you go to sleep as an adult, or even as a kid, but definitely adults too, because more adults have sleep apnea,
Mm-hmm.
maybe that tongue isn't strong enough to stay up during the night. So it falls back and then you wake up, or it's low in your mouth, so then you snore. And then it's creating these vibrations in your throat, which inflames everything when you snore. And so then everything is inflamed. So then your airway gets smaller.
Mm-hmm.
And it's kind of like a continuation cycle, you know what I mean? And then you do have, so if everything's inflamed, your tongue isn't strong enough to hold itself up, and you're snoring, I would say definitely if you catch yourself, waking up multiple times a night, going to use the restroom, if your significant other spouse has said you snored, or you wake up gasping for air and you're like, or why do I keep waking up, tossing, turning? Go get a sleep study. Really.
Mm-hmm.
Because, and they do sleep studies at home now. That's probably one of the more common things now, is to get it done at home, because just get it checked out, see what it says. Maybe you have some sort of sleep apnea. But myofunctional therapy can help with that. I never want to say do one thing or the other. So, if they're recommending a CPAP, or there's different forms, whether it's an APAP or a BiPAP, if they're recommending that, great. But some people struggle using those. You know what I mean? And
Mm-hmm.
I was just talking to someone the other day, and their compliance with their CPAP, so they can sleep, so they can function, so they can feel better, isn't working for them. And I'm like, okay, let's have a conversation around this. Why are you
Totally.
struggling with it? You know what I mean?
Mm-hmm.
And sometimes it's the pressure's too high, so it's uncomfortable. I'm like, okay, let's strengthen those muscles, so maybe we can turn the pressure down a little bit so it is more comfortable. If it's nothing crazy and you have just very, very mild, I'm like, let's do some myofunctional therapy stuff. Let's strengthen the muscles of your tongue so it can stay up by itself, so it doesn't fall back. You know what I mean? Let's keep
Mm-hmm.
your airway open. Let's strengthen all those so you maybe don't have to do that.
Yeah.
So it can really help anyone of all ages, ranging from a spectrum, because you even see sleep disordered breathing in children, I think.
Yeah.
And a big thing with children is grinding their teeth.
Mm-hmm.
And I think it's become, sometimes normal isn't healthy. People are like, oh,
Mm-hmm.
that's normal, but is it healthy? You know?
Yes. Yeah.
So, which is, I'm sure you completely get that being in the world that you're in. They're like, oh, well, everyone does that. Or,
Yeah.
I'm like, but is that
Yeah. It
healthy?
comes normalized. Yeah. And then I
Yeah,
assume it causes, right, like will cause issues down the line as they age, right?
yeah,
Yeah.
yeah. So it's interesting. A lot of times when you're going to sleep and it's trying to get comfortable and you are trying to breathe, maybe they're saying that you'll grind your teeth, to create airway space. You're struggling breathing, so that kid is grinding their teeth
Hmm.
to subconsciously create space for their jaw to open up.
Oh.
Or, yes,
I
yes,
didn't I didn't think about that. I was like, why is teeth grinding? But that makes sense.
yeah,
So it's pushing your jaw forward to create more space.
to
Okay.
create more space.
Hmm.
And there's a different kind of appliance, a mandibular advancement device, which does kind of do that. And those devices work great for some people. So it kind of takes their lower jaw and puts it a little more forward to open up the airway space in the
Hmm.
back to give them a little bit more. And I'm like, okay, if your kid is grinding, maybe note that. How is your kid sleeping? What do they look like when they sleep? Are they contorted in a weird way to try to make themselves comfortable to open up their airway? Are they wake up and it looks like a tornado went off? Like, how is your kid sleeping? You know what I mean?
Yes, that's
And
a good segue, yeah, into my next question, which is like the red flags that parents should look out for. Like that's a good one. Are there any other red flags that you would say to watch out for kids, for adults?
yeah, I mean, I would say red flags to look for yourself and your kids: open mouth posture day and night. Are you breathing through your mouth, or are you breathing through your nose? And a lot of people aren't even aware that they're doing it. So just bringing attention to it, I'm like, let's get us nasal breathing. That is going to
Mm-hmm.
help you. Um, are you snoring or restless sleep, both you and kids? Dark circles under eyes. Um, so those are, we like to call them, like, it's venous pooling, kind of like allergic shiners, that sort of thing. So allergic shiners more in kids. Are they so congested that they are breathing through their mouth, which then pools all the blood, so they have those dark circles under their eyes? Do you have chronic headaches? Are you grinding your teeth? Do you have a forward head posture? And some people are like, how does how does the forward head
Mm-hmm.
posture bring into it? Well, your body's really smart. It's gonna
Yep.
do whatever it can to make things easier. So it's gonna push your head forward if that's gonna open up your airway. And so that's another thing to look out for. So those are a few things like red flags to look out for. Um, and really, I would say other people will notice some of the other things, but just pay attention. Are you breathing through your mouth or through your nose during the day?
Mm-hmm.
You know, nasal breathing it's amazing what it can do for you. And I think some people they get really used to it, to not feeling good, which is sad. They're like, "Oh,
Mm-hmm.
I've been fine. I've been breathing through my mouth, my whole life. I'm fine." But I'm like, "Okay, but by breathing through your mouth, you're skipping the humidifying of the air, the purifying of it. You're not creating you don't have the nitric oxide release from your sinuses." So I'm like, are you really okay? And to me, it's just coming from a place of, I want people to feel better.
Yeah. Well, and, right, because yeah, if you're mouth breathing more often than not, that's going to lead to more fatigue.
Mm-hmm.
Well, and that's why maybe you're tired all the time, or and also it's inefficient, right? Like I don't know the actual.
Yes.
I've learned about it, but like the statistics of like how less amount of oxygen you're getting in, how much that is like way more work for your body and causing more
Mm-hmm.
inflammation. It's
Mm-hmm.
wild.
And
Yeah.
that's the other thing is also too, it skips the filtering process. So someone that is, especially, I don't know how it was in Colorado, but I'm in Minnesota, and from the Canadian wildfires, the air is disgusting.
Yes.
You're
Yeah.
telling me I just want to take that straight into my body and not be filtered at all? No, thank you.
Yeah, that's terrible. And
You
that
know what
leads
I
to other
mean?
issues. Yeah.
Yes, yes, no, but nasal breathing is a really it should be a natural thing, but sometimes people struggle with it, maybe because they're congested, maybe they have a deviated septum, or maybe we just need to retrain those habits and strengthen those muscles. You know what I mean?
Mm-hmm.
So I
Yeah.
always like to talk about nasal hygiene with my patients, keeping that airway, your nasal passages open,
Mm-hmm.
whether it's using like, I use one, it's a nasal spray, it's from the brand like Clear with an X.
Okay.
You can use it, it's a xylitol spray. So you can use it
Oh,
multiple times
nice.
a day. Yeah, just to clean things out, especially if you know you maybe a certain time of season, or just add it to your nighttime routine. I love just a couple squirts in one nostril, few in the other before you go to bed. It doesn't take very long, but nasal breathing is I feel like it's kind of a hidden gem, especially when it
Mm-hmm.
comes to performance too, which
Mm-hmm.
I'm sure you would love to talk about.
Yes, yes. Um, yeah, we can segue to yeah, let's segue to that. The impact of nasal breathing on yeah, performance, recovery. It was really fascinating because when like you put that on there, I was like, yes, because at the gym I work at here, there's been times and like they do a 6-week training program, right? And there
Mhm.
was a block last year and intermittently they'll add it back in, which is CO2 training. So, which is so hard. Like, right? Like you do a sprint and then you hold your breath
Mhm.
and we would record how many seconds you got. And, some people like are phenomenal at it, right? Could get like 20 seconds, which is wild, or like 10 or 5, right? And there's a big spectrum, but yeah, would love for you to kind of share more about the impact of that of like nasal breathing, but I just thought I want to share that with you because it was super cool to like do that and like I've incorporated there's like one where you could just do walking, which I think
Yes.
is fun, right? Like where you just like hold your breath and you count how many steps. So,
Mhm.
um it's so cool to train because like your brain is like or you're freaking out, right? Like you feel like
Yes.
you're drowning, but really
Yes.
it's like no, you're safe. Like you can handle this.
You're fine. You can do it. And it's really cool too. I love doing the walking one because a lot of people go for walks. Even if
Mhm.
you're just at work, maybe you don't go for a walk, but you're just at work and you're walking in the hallway. You know what I mean? I'm like, that is
Yeah.
such an easy way. You're sitting at your desk, do a quick nasal hold. Plug your nose, do a quick hold. It's such a easy way to increase your CO2 tolerance, you know? And so nasal breathing, when it comes to athletic performance, it helps you recover faster in between rounds. Also, when you're resting, after you leave the gym, it gives more oxygen to your muscles. So you can do more work with the same amount of oxygen. So you don't tire out as quickly. And
Mm.
once you get used to working out nasal breathing, like for me, I've been very conscious about it. I made an effort about it. I cannot go back, you know? And it's so hard because I've tried it a little bit and I'm like, I feel terrible. Like
Yeah.
you
Mm-hmm.
you tire out so quickly, you know? And and so even just the ability of nasal breathing when you're working out to calm your body down, to put you in more of a, like, yes, you're working out, but to put you more into a parasympathetic, you are sympathetic, but to put you into a slightly more relaxed position where you can do another rep then. You can,
Mm-hmm.
you know what I mean? Where you can push a little bit harder. Because when you're nasal breathing and your tongue is up and it's on that spot resting on your palate, we have palatal nerves that run and they'll come, and they hit behind your two front teeth, kind of on that bump. We call it the incisive
Mm-hmm.
papilla, and that's what we call the spot. There's palatal nerves, and when you rub up there and when that is stimulated, that stimulates the palatal nerves, which then puts you in to the parasympathetic mode. And
Mm-hmm.
so even I've talked about, anxiety with some people. I'm like, let's do some breath work and let's think about your tongue posture. Let's get that area stimulated so we can relax your body, calm your body down. And that is one thing too, is there's a couple different devices out there that can help with this. There's one that's awesome. It's called Sport Pal. And so it's an appliance that you can wear when you're working out and you pop it in. And the great part is the sport one, it doesn't cover your front teeth so people don't know you're wearing it.
Oh,
But there's a little
cool.
thing in the back of it to cue you to get that tongue to the spot. And
That's
so
cool.
yeah, it's
Dang.
great. It's awesome. You can either like send in a scan or you can order like an impression kit and then it's custom made to you and you get it back and you can wear it if you're lifting, if you're running, anything like that. But being able to stimulate and calm your body down while you're working out is also going to help you perform better
Mm-hmm.
because you're not like freaking out
Yes.
and everything like that. You can focus, you can concentrate, maybe you can get that other rep in because you're nasal breathing. And so you can do more work with the same amount of oxygen. So it's really cool to not only personally, but like talk to other people that have done
Mm-hmm.
it and just to see their small wins, even if it's, oh, I did 20 steps this time or I did 10 steps this time and just slowly trying to increase that. And I think too, like people like to sometimes give themselves a challenge and then see themselves do that. Like I did it.
Yes.
You know what I mean?
Yes. Yeah, to like see the progress. And I love that you shared about that tongue powell thing. I'll definitely have to look that up because I think a lot of people would utilize that.
Yeah.
Because especially when your heart rate's really high, it's really hard to like go right into nasal breathing, but to have like something that cues you might be really helpful for people.
Hmm.
Um, why don't you share about since I kind of talked about the walking breath hold, but if you don't mind sharing like what that is and like why it's important to train your CO2 tolerance as well.
Yeah, yeah, for sure. So, nasal breathing increases the benefits from it and everything like that. Basically, you want to increase your CO2 tolerance. So, carbon dioxide is a signaling molecule, really. So, if you have a buildup of it, it tells oxygen to be released to your muscles. Okay? If you are breathing through your mouth and you're losing that really quickly, you're displaying all that carbon dioxide really quickly, it never has a chance to build up to signal the oxygen to get to those muscles.
Mm,
So being able to breathe through your nose, build up that CO2, build up that CO2, and then as you challenge yourself to work on increasing that, you can get, that oxygen to your muscles and to be able to perform better. So a great book is it's by Patrick McEwen, and it's called The Oxygen Advantage. Have you read it?
No, but I've heard it like when I like before this episode, I like looked up CO2 tolerance, that came up, and I was like, oh, I need to read this book.
It is awesome, and it lays it out like step by step how to do it. So
Cool.
even if you just start small sitting at a desk, or even when you wake up in the morning, just check where you're at. So um what you can do, this also works really good for to like unblocking your nose if you're congested too. That's it's pretty similar. So what you can do if you want to, increase your CO2 tolerance, so it makes it easier to nasal breathe and work out, start doing breath holds. I really like to, you breathe in through your nose, you breathe out through your nose, and then you hold your nose and then sit there, kind of let that build up a little bit. And then once you feel that urge to breathe, release your nose and breathe in through your nose. Do not open your mouth.
Mm,
And then you can time yourself and slowly try to increase that. And then from there, a way to step it up would be to start doing it on your walks. If you're like, okay, I'm gonna try to do X amount of steps this time, and just try to push yourself, even if it's just like a few more steps. And then
mm-hmm.
step up from that would be slowly trying to incorporate it while you're working out. And so this is something you do have to be conscious about because you're already working out. And I know some people that will go as far to like tape their mouth when they work out,
Mm-hmm.
which if you really want to, I would recommend making sure though you have other healthy patterns before that. Do not jump
Yes.
straight to that. Please do not jump straight to that. You know what I mean? But being able to start small, start sitting, start when you're relaxed, and then slowly build on that to increase your CO2 tolerance. So then when you do go into the gym to go work out, you've already done the sitting, you've done the walking. Okay, let's
Mm-hmm.
try let's try while I'm lifting today. Let's try if I'm doing some cardio today,
Mm-hmm.
And so just trying to really increase your CO2 tolerance will increase your athletic performance. You'll feel better, you'll recover faster. It's kind of a hidden little gem. Yeah.
I love that. It's so fun to train. Yeah, like it's just a cool like practice to have. What are some like good times or like steps? Like what is some, a good rule of thumb to like shoot
Yes,
for?
yeah. So starting off, it's not uncommon for someone that doesn't maybe train super often, maybe just here and there for fun. It's not uncommon to have like maybe around 10 seconds, when they're sitting there. It's not uncommon for that to be like, okay, I need to take a breath. And then someone that works out, that does more cardio, that does their weights, they're trying, you know what I mean? Maybe it is that 15. And then someone that has practiced it, I would say, someone that has been practicing it is consciously focusing on it is more around that 20 seconds. And then like 30 is something, if everyone could work up to 30, that would be amazing. But
Okay.
that realistically, that wouldn't be feasible for everyone. But 30 is like an incredible one. 20 is you're an athlete, that sort of thing. 15 is, you're getting there, you're making an effort. And then 10 is where a lot of people start off.
Okay. That's super
Yep.
helpful. What about for steps? I know everyone walks it. I guess that one might be harder, but like, is there a steps goal
It's
to have?
as far as like how many in between.
Yeah, like how many steps to like is a good like average to get to when you're holding your breath? Do you know?
So walking and doing it is harder because you are getting in a little bit more of that
Yeah,
movement.
that's okay if you don't.
I
Yeah,
was gonna say cut this. I actually have it and I'm trying to remember what it is. I,
that's okay.
I'm like,
You're fine.
I'm trying to, I can get it really quick.
Okay. I think it's like,
I-
yeah, I don't know if it's like
It's like
20 or
20.
30.
Yeah. It has like X amount of, oh, here's one though. Oh, okay. There's the paces if you're stimulating high altitude training.
Oh,
Yeah. So that's when it looks, otherwise, a lot of times it goes off of seconds.
okay.
Otherwise, the high altitude training, is more paces where it mentions it for 10 to 40 paces.
Okay. So 10 to 40. Okay. Yeah, that's helpful.
And then
Yeah, I would assume 10 is like beginner,
mhm,
20 to 30, and then 40
is
is
like
great.
this
Yeah.
person has been
Yeah.
working at this.
Yeah. Yeah. Wow, super cool. Yeah, I'll have to check out that book, The Oxygen
Yeah,
Advantage. Cool.
oxygen advantage. Yeah.
Cool. I love
Good.
that.
Okay.
Well, thanks for sharing that. And then kind of yeah, segueing back to like so we talked about the CO2 tolerance, little ways you can kind of do that. Yeah, whether it's at your desk or you're walking around your office or even
Mhm.
outside. Um or even just paying more attention, I'm sure, right? Like throughout your day, how you're breathing. What are other quick ways, like maybe just top two or three to improve just breathing at home and then sleep?
Yeah. Couple of quick ways to improve sleep and breathing at home that are, you don't really have to, you could start this right now. So check and practice nasal breathing. Create awareness around oral rest posture. Are your lips closed? Is your tongue up? Are you breathing through your nose during the day? And so if you notice all those things and you're like, no, I'm comfortable with that, I don't recommend jumping to mouth taping at night right away. I don't recommend that for most people. I think you should have a little bit stronger of a foundation. So you could even see how you feel doing that during the day, just watching a show. If
Hmm.
you taped your mouth together, you're like, is this completely fine? Am I comfortable? Or maybe you notice you're like, this is hard. Okay, that brings awareness to that. Let's work on that. Um, Something I like to incorporate, like I kind of mentioned with the nasal rinse, is your evening wind down routine. Add in a quick little nasal spray, or add in a breathe right strip, or a mute dilator, or whatever it is. Open up that nasal passage so it is a little bit easier to breathe through your nose during the night, so then you
Hmm.
don't have the resistance of that making it already harder. So that's a really good one that I do every night.
Oh, cool.
Yeah, I love that. It just helps open everything up. And then another good thing, easy thing to do is morning sunlight for your
Mm.
sleep. And I think it's been on quite a few podcasts, if you're kind of in that world, get some sunlight in your eyes in the morning. Help set your circadian rhythm and like create that sleep hygiene routine. So it's like create that sleep hygiene routine. Keep the little spray bottle out. Maybe do a few at night before you go to bed to clean your nose so then you can sleep better. And it doesn't have to be some like big crazy thing. I think morning and night routines have like gotten so glamorized
Yes.
nowadays. And I'm
I
like,
know.
I'm
It's so
like, oh
crazy.
my gosh, just one more thing to do. Okay, even if you just slap a breathe right strip on your nose and in the morning if it's not bright out, okay, have a light in, don't shine light into your eye, but have some sort of something to wake you up to help set that circadian rhythm. It doesn't have to be anything
Hmm.
crazy. So those are like three pretty easy ones that you can do like right from the jump. Just see where you're
Hmm.
at. Create awareness, check yourself, are you breathing through your nose? Try doing it, during the day. Just breathe through your nose, add a little mouth tape, notice if that's uncomfortable or not. Clean your nose, put on a breathe right, and get some sleep, and then get some sun in your eyes.
I love that. No, those are really helpful tips. And I love that you brought up the mouth tape thing too, to like see how it feels, even
Yeah.
just for like an hour or like, yeah,
Yes.
watching a show or during the day. Because
Mhm.
I think what I've been mouth taping for years now, but like I didn't start that way, which I probably should have, because it was like, I remember like waking up, I'm like, where'd the mouth tape go?
Well, and that's
So
the thing. Some people are really freaked out by the mouth tape, and I'm like, I promise you, how for the first probably month you do it, you're gonna wake up with that thing ripped off, with it in your
yeah,
hair, on your
yeah.
face, like, you know what I mean? It doesn't.
So that's why,
It's
yeah, I think
something to
it's good,
adapt
like you
to.
said, to like ease your way into it because you don't really know like how how it feels and bringing awareness
Yes.
around it. Yeah.
Mhm. Yeah.
Is there a brand that you really love, or like do you just like,
I
normal tape or yeah.
There's a lot of brands, this might be a hot take. There's a lot of brands that
Yeah.
are charging, I think, a lot more than they should.
Yeah. Totally.
So this may be a hot take. I love them. I've used them. I love them, but it's something I throw away every single day. And
Yes.
so when you're looking to me, I just get it's medical, it's just like medical grade porous tape, and I just put a strip over my mouth. I'm like,
Yeah.
it is so much cheaper to buy that, and it does the same thing. It's medical
Yeah.
latex free, it's sensitive skin. You know what I mean? Like,
Mm-hmm.
because there is some that are great, but I'm like, do I need to spend $50 on tape?
I know, which I think is so funny because yeah, like you said, there's so many brands and they look so beautiful and like
Yes,
nice. And I'm like, yeah, but then you throw it away. Like,
throw it away. So
yeah.
I'm like,
So
that's something I probably don't need to be super bougie on.
yeah. Yep.
Yeah, yeah.
Awesome. Okay. And yeah, that was really helpful. Okay, so morning sunlight awareness, just how you're breathing, mouth tape during the day, and then the nasal rinse or spray, and then the birthright or what's it called?
Breathe right.
Breathe right. That's right.
Breathe right strip. There's even
Yes.
there's one called a mute dilator. It's
Mm,
like a harder plastic. I have both. I personally like to wear the mute during the day and then the breathe right at night.
okay. Cool.
I don't really like the way I notice the mute maybe at night sometimes it's just not quite as comfortable.
Yeah.
So I like to wear that one during the day. It's really subtle. I got a clear one. I don't have it in right
Okay.
now, but I got a clear one. It's super subtle, so it almost just looks like a little ring under your nose almost.
Oh,
So it's great if especially if you're like working from home or
yeah.
doing stuff like that.
Okay.
And then I like to use the breathe right ones at night, and just make sure that you're putting it on. Like, don't put your face lotion on and then immediately put it on because it won't stay.
Yeah. That's
You know?
true. That's a
Yeah,
good point.
yeah,
And then are there any other like myths that you want to like debunk that
yeah,
you hear a
yeah.
lot about? Yeah.
So that's the other thing. I feel like there is quite a bit of myths around myofunctional therapy. Some people are like, that's not real. And I'm like, have you read the literature?
Yeah. Have you looked
Um,
at the science?
yeah, have you looked at the science? Which is fine, and I think they come from a good place.
Hmm.
But until you are even educated on something, really everything is kind of like, oh, you know what I mean?
Hmm.
So one common myth is that tongue ties only matter for babies, which is a complete lie. Because if you're an adult and you have a restriction, your tongue is not going to sit high up in your mouth on your palate where it's supposed to. It's going to be hanging down low, probably hitting your bottom teeth. It's not going to be resting up high. So tongue ties don't only matter for babies. They definitely matter in adults too because it affects your whole body, kind of like we've gone over. Maybe you have headaches or your mouth breathing then, or you have TMJ because it's putting a lot of pressure. Maybe you are having trouble doing certain things. You know what I mean? So tongue ties is definitely not only for babies, and I think sometimes they can be missed. They're definitely missed, especially if they're not an obvious tongue tie. There's subtle tongue ties that do affect your function, just like how not everything is black or white. So
How how would you know if you had one? Like an evaluation, I would assume?
yeah, yeah,
Yeah.
yeah. So definitely get an evaluation. And I always do like I offer a free consult, 15-minute. If someone's like, "What the heck is this?" I'm like, "I want to fill you in." So I offer a free complimentary like 15-minute discovery call. And then, we could talk about that. We can do a few things to check. So if you are struggling to get your whole tongue to the palate, if you're like, can my tongue rest up there comfortably? And if it can't, I'm like, okay, let's check into that a little bit more. Maybe there's a reason. Maybe there's a physical restriction why your tongue can't get up there.
Mhm.
Another common myth is mouth breathing is harmless if you can breathe. And we kind of alluded to it earlier. By mouth breathing all the time, you're doing this shallow chest breathing. You're putting your body in a very sympathetic position. You're expensing so much carbon dioxide faster and quicker than your body should be realistically. You are bypassing the humidifying, the nitric oxide production, the filtering, the benefits of nasal breathing. So And if you're mouth breathing during the day, there's not a chance that
Mm,
suddenly at night you close your mouth, you know? So
yeah.
so then maybe you get so common to having your mouth open, your tongue drops down, and maybe now you're snoring or sleep apnea. So that sort of thing. So mouth breathing is definitely um it it affects your body and how you feel. And so that's definitely a myth that it's harmless if you can breathe.
Mhm.
Do you have any questions about that?
No, I don't think so. No, yeah, I think we alluded to that earlier, which was really helpful to think. Because, like you're saying, if you're breathing, if that's how you're breathing during the day, yeah, there's no chance you're probably
Oh,
closing your mouth at night.
yeah.
Um,
And that's the other thing too is mouth breathing and having a low tongue posture, especially when you're younger, it affects the way your face develops.
hmm
You know, do you have a long, kind of more narrow and a little more bags under your eyes from some of the pooling, or it was your mouth, is it shut? Are you nasal breathing? That sort of thing. So it definitely affects jaw structure. So if your mouth is hanging open, low, not supported, um, you probably have grown into a little bit smaller of an airway versus,
hmm
closed, opening everything up, that sort of thing. So yeah. Um,
Awesome.
another one I like to talk about too is that orthodontics alone fixes the problem. And we kind of alluded to this earlier is it fixes an aspect of it, but if you don't retrain those muscles how to work, they're not going to automatically know how to do that. If they've been doing one thing for how long and then something changes, it's not going to automatically know, you know.
hmm
The same thing too is sometimes depending on kind of what era we were in, sometimes people were just like releasing tongues, doing a tongue tie release, but they didn't have any myofunctional therapy. But it's like, okay, so say your fingers were tied together and then you snip, or they're doing like shallow ones, but they need a deeper release. And it's like you snip the first part of it. You know what I mean? Okay, so this
Yeah.
this can move, but you're still missing out on all this other range of motion if it like wasn't fully done. And how is it going to know how to move properly? Yeah, it's like you
Yeah.
just have to strengthen those connections, build those muscles so your body knows how to move properly if it had a restriction or a limitation somewhere. And then another common one is kids will grow out of grinding their teeth. Um,
Mm,
you don't really grow out of it as a kid, especially if it's an airway thing. Because if it's an airway thing when they're younger, they'll just have the same habits as they get older. Your body's still gonna be trying to create enough space. You'll still is gonna subconsciously create that space by grinding their teeth. Um, so, and it's grinding has gotten to be so normalized, and I do think it is multifaceted. But if you do have a grinding issue with your teeth or clenching or grinding, or if you do wear a night guard, that's great. The night guard's protecting your teeth, but why are you grinding?
yeah.
You know what I mean? And it's like, yes, the masseter, which runs along here, is, directly related to that fight or flight that we talked about. So if you're sympathetic and you're clenching because you're breathing through your mouth and you're so wound up, yeah, you probably are clenching. And you know what I mean? So it's like, but why?
Yeah.
Why are you doing that? Is it because there's an airway space issue? Is it because you have a low tongue posture that we need to get up to help stabilize that jaw? So it kind of opens a whole conversation. And myofunctional therapy it's multifaceted. You work a lot of times with other providers depending on what the person needs, and it's collaborative, very collaborative,
hmm
especially if someone has, pain with their body. I'm like, okay, let's maybe get some physical therapy. Let's get some musculoskeletal work, especially if a body was wound up one way. And as you slowly release things, other things kind of come about. You know what I mean? So
Yes.
it's
Yeah.
really a whole body approach at the end
Yeah.
of the day, is what I'm
I
saying.
love that. Yeah, I love that it's like you're also working with these other providers too to help them and like get to the root of, because it could be multifaceted of like many factors of they're just stuck in chronic stress. So then their teeth grinding, but then they're also like impacting the way they're breathing. And, so I think there's probably a lot of factors there.
Yeah.
What, do you mind sharing like any like cases or like patients that you've had like great success stories with or just like interesting, you know,
I
experiences? Yeah.
Yeah, I personally, I love working, I see people all ages, but I do have a soft spot for adults, oddly enough, because I think as an adult, you've already lived a lot of your life doing things a certain way. And as an adult, it's also harder to be like, I need to work on something.
Mm-hmm.
I'm not doing something like correctly, not per se. You know what I mean? It takes a lot of introspective work to be like, I should do something about this. You know what I mean? And so I do have a soft spot for adults, especially I have someone very close to me um, who is very much so skeptical of everything of it and dealing with a lot of sleep disordered breathing.
Mm.
And I will say it is such a good feeling to have someone that was very bad, severe sleep apnea, did not feel good, but they had gotten so used to that they thought that was normal. And then when you start working on things and they maybe go get a sleep study and they're like, wow, this is why I feel like crap. But we can do something about that. Let's get you better.
Mm-hmm.
And then to see that transformation from where they start and to see their energy levels shift and those compensation patterns change, I'm like, I just have such a soft spot for adults, truly. And it's like, I love working with, kids too, because their bodies are still so formative. So you can kind of
Yes.
prevent a lot of this. But truth be told, a lot of things, I think it's getting better now, but for so long, these things went uncaught early. And so I do have such
Mm-hmm.
a soft spot for adults that realize this and they want to educate themselves on this because that's, you know what I mean? And to be able to see their quality of life change, that's what I
Mm-hmm.
love. I love it so much,
Yeah.
whether it's their TMJ that they were dealing with, whether they had terrible tension in their neck and head because maybe they were compensating or they had a really tight restriction under their tongue that was causing everything to bunch up, or if it's their sleep apnea, or they've done ortho and they still have this tongue thrust swallowing pattern that's pushing their teeth and they're like, I've done ortho 3 times, you know what I mean? And it's
Mm-hmm.
like to finally get them to where they're like, oh my gosh, like their quality of life changes. So
That's
I,
amazing.
yeah, I really love seeing adults. I have a soft spot for them.
Yeah, that's so awesome. And like again, I think it's cool to like you said, cool to see their transformation because I think what happens is when you get yeah, later in life, right? You're like thinking it's too late or you can't change how you're feeling. I think we
Or
get
they're
stuck
like,
in
I've been like this my whole life.
yes.
There's nothing wrong with me. Or even the fact, I think sometimes too, depending on the personality of a person, it's hard to admit as an adult, like, oh, I need to work on something like that. You know what I
Mm-hmm.
mean? It's very
Totally.
personal.
It
Not much,
is very
it's
personal because
personal.
again, it's something that's like automatic. Like
Mhm.
most people, right? You're not thinking about training your breath or realizing how you're breathing, but it impacts, like you said, every system of your body, like how you're sleeping, how you're managing your stress, your athletic performance, I'm sure cardiovascular health too.
Yeah, yeah.
Um,
Well, that's the
so
thing. And it kind of brings it full circle too is um, mouth breathing, it causes a lot of inflammation in your body because you are in that sympathetic mode, your shallow chest breathing, your stuff's not being filtered. You have a lot of inflammation in your body. If you're also mouth breathing during the day, you're probably not sleeping well at night, which you're not getting that deep restorative sleep, which just leads to more systemic inflammation. You know what I mean? So that systemic inflammation is not impacting your body,
mm-hmm,
impacting your body in some aspect. You know what I mean?
totally.
And so
Yeah.
just to be able to bring all that down, you know what I mean? It's
Yes.
not gonna go unnoticed. It is gonna you're going to have an increased quality of life. You know what I mean?
100%. 100%.
Yeah.
Yes. Oh my gosh, I love it. Yeah, this has been so like informative and like again, something that I think a lot of people just aren't familiar with or yeah,
Yeah.
maybe haven't heard about. So like for you to bring this education, I think is so exciting.
Yeah.
So thank you. And I want to ask you a few just my signature question and then where they can find you. So my signature question that I ask is with this podcast, my goal is to help the listeners overcome their fears, lean into growth with all aspects of health, wellness. So for you, like what have you done in your life that took tremendous growth, but you had to like get out of your own way and out of your like get out of the fear of doing that? What would that
Honestly,
be?
becoming a myofunctional therapist.
Oh,
It,
awesome.
yeah, it was a weird time. I was not happy with my career. Um I was interested in this, but maybe I had some people that weren't very supportive about it or around it or even in the work environment that were like that's not real. And I was like I kind of had to bet on myself. I was like,
Mm-hmm.
okay, I'm gonna quit hygiene. Like you know what I mean? I'm like, I need to do this. I want to do this. And some people were like, this seems kind of like a bad idea, Emily. And I'm like, no, so to be honest, it's kind of funny because honestly, I think becoming a malfunctional therapist and leaving my job, going back, getting this training, you know what I mean? So
Yes.
it was very uncomfortable because there was also a lot of unknown with it too.
Mm-hmm.
So honestly, I would say that.
That's awesome though. That's so cool and so worth it, I'm sure, right? Like you found something you're
Yes.
so passionate about and can help improve your patient's quality of life, which is like so rewarding and so fulfilling.
Yeah.
And is it so? I guess I don't even like how is it very like is there so many clinics around like or how how
Yeah. How do
popular
you
is
go
this?
about?
Yes.
Yeah. So I would look at there's like an airway directory
Okay.
and I can always get those sent over to you too, but you can find, airway providers in your area because not every it is in the ADA and the ADHA now both
Okay.
talk about the American Dental Association and the American Dental Hygienists Association. They do talk about it now, but it's still, we are supposed to be doing airway screenings, but in many places and in many offices, that's not happening. Um, I think, and not to their fault. I think it is a field where you have to be able to be willing to learn still, and put the time into learning because it's not talked about a lot mainstream in school. You're so busy doing other things, which is why it is a specialty.
Yes. Yep.
um, so I would look at, find someone that mentions, if you go onto their website, like airway provider, if they talk about myofunctional therapy, if they talk about um, using like a CO2 laser even for like doing tongue tie releases, kind of look for those things to see if they're a little bit more into that field. Um, and I would say that would give you a pretty good the airway directory. There's also he's very well known. A very great resource is Dr. Zaghi in California. He has a provider directory guide on his website where you can look
Cool.
up and find different airway providers that have maybe been like trained by him and that sort of thing, kind of in your area as far as doing the release. But as far as looking for a malfunctional therapist, I mean, malfunctional therapy is a lot of it is you can have in person and remote. A lot of it's remote. It went remote after COVID and people loved
Oh,
it.
okay. Yeah.
So I see patients just remotely right now. So that's always an option too.
Yay. Yeah. So where can people find you
Yeah,
and work with
yeah.
you?
So you can book online with me. I believe it should be in the show notes.
Yes. Yep.
Um, it is my email is emily@integrativemyotexas.com. My Instagram is m_gardeski, and you can book online with that link, and then also at Integrative Myo Texas. And
Beautiful.
for your listeners, I want to do 25% off a comprehensive evaluation. If you so when you're booking, put in the little note section, Sarah, and then I'll know to adjust that accordingly. I would love to do that for your listeners because, especially if they're listening to this podcast,
Yes.
they're
Yeah.
growth minded, they want to grow, they're trying to better themselves. I want to do something for them, you know,
That's so sweet. Thank
taking their
you so
time.
much.
Yeah,
Yeah,
yeah.
definitely take advantage of that. I think so. How long is that comprehensive evaluation?
Yeah, so the comprehensive evaluation typically takes anywhere from 60 to 90 minutes. Um, and if people are curious about what therapy looks like, because that's the other thing, they're like,
Yeah.
can I work this into my schedule? I'm so busy. I have 3 kids running here and there, that sort of thing. So we meet, a general rule of thumb is we meet every 2 weeks for maybe about 40 to 45 minutes. You know,
Okay.
sometimes it's a little bit shorter. It typically doesn't go more than that. We check in on the exercises you were given. I give you new ones. I watch and give you some cues. And then I also send you, you get links then with all the exercise videos that I have assigned to you and that sort of thing. And then each day, I would say 10 minutes total a day is
Oh,
really,
awesome.
yeah,
Yeah.
so it's very doable. You can break it up how you want. I don't care how you break it up as long as you're doing it and you're improving. You know what I mean? So some people do it all one sitting and then some people break it up in the morning and the evening. I'm like, whatever is going to get you to do it, I'm on board.
That's amazing. That's awesome. And especially for like something so quick. Yeah, 10 minutes. You can incorporate it in the morning or the evening with your nasal spray in the morning sunlight,
Yeah, great.
which is awesome.
And
So,
there is some passive exercises too, or different devices. For example, there's a Myo Munchie that I love, by the way. It's great. Um, and you pop that thing in and you chew on it a little bit and you're chewing and it's also strengthening your lips and that
mm,
seal. But you can pop that in and like do other things.
oh,
Know
nice.
what I mean? And
Yeah.
yeah, so there's things that definitely enhance therapy and make it a little more convenient like that
hmm
too. So,
Cool. Amazing. And Emily's been so gracious to have some resources that I can't wait to put in the show notes for you guys to check out too. She like incorporated like an adult screening tool, a child screening tool, some like other tips for sleep hygiene, perform things we went over, performance and nasal breathing as well, and how to know if you're a candidate for this type of therapy as well. So that is so helpful. Thank you for yeah creating all those. They're
yeah.
beautiful, well done, and yeah, really informative too. So
And I
thank
don't
you.
know if other people are like this too, but I'm like, oh, I listened to something great. But when I can see it visually and like do a little checklist on myself or my kid, or I'm like, I believe those steps that I sent you for the athletic performance, those are pretty like pretty bulleted, like we can do
Yes.
this. So
Yes.
please people print, use that, look into it, print it out, please use it.
Thank you so much, Emily. This has been so great. Thank you for sharing your knowledge. And I know the listeners will walk away with such a deep understanding of how something as simple as how you breathe and your mouth and jaw can really influence your entire body. So thank you.
Of course, thank you so much for having me.
Of course.